patient preparation for PCI, the most important thing is that you tell the patient, in my opinion, what's going to happen. So clearly the first thing is to actually obviously have the consultation, make sure that the patient is aware what the indications are, and obviously that there is justification for doing the procedure. And then once that's been done, then it's a question of making sure that all of the other aspects of the procedure are in place. It's one of those things that, considering what is actually going to be done to the patient, i.e. having something inserted inside one or more coronary artery whilst the patient's awake, and usually just talking to the operator, whilst the procedure is being done, and the nursing staff. It's remarkable really how straightforward it is. From the patient's point of view, the most important thing is that the patient starts taking appropriate medication, which is medication which is designed to make the blood less sticky. Patients often say it thins the blood. It's not, but it's to make the blood less sticky, and the reason for that is that when we put stents inside the artery, we don't want the patient to form a blood clot inside the stent. So we like to start these medications a few days. This would be aspirin plus an additional tablet, something like clopidogrel or prasugrel, something along those lines, but that's really very important. We also ask the patient to make sure that they have prepared the route of access, so that would be either shaving a small area of skin just over there in their right wrist. If we're going for a femoral approach through the groin, then we'd ask the patient to shave probably both groins, just to make sure that we have the potential of access on both sides, and then to come to the hospital in a good frame of mind, relaxed. We ask the patient not to eat anything for sort of 2 or 3 hours before the procedure. I allow my patients to drink plain water up really until the time that they're taken to the cath lab, and then if they wish to, they can be sedated on the table if it's going to be a prolonged procedure, like if they've got a complex angioplasty involving 2 or more vessels, or if they're going to have something like angioplasty for a complete occlusion, then actually we have what we call a bear hugger, which is a special blanket that we have on the table to keep the patient warm. So essentially the patients are relaxed, they're sedated if they wish to be, they're on appropriate medication, they know what's going to happen, and generally I find that leads to a happy patient and a sort of content patient, and it usually makes the procedure pass uneventfully.